Welcome to SAAT School. I am Sabina. In this video, I would like to provide a quick overview of nursing in Canada. By the way, I am a registered nurse in Canada, also currently enrolled in nurse practitioner program. In this video, I'd like to discuss about following topics. They are: what is registered practical nurse, registered nurse, nurse practitioner, what are the qualification, roles and responsibilities, and what is my experience as an RPN and RN, demand of nurses in Canada, their salary, and how to apply for permanent resident in Canada. Let's get started. First thing first, let me tell you why you should choose Canada. The first is, it is one of the safest nations in the world. It has been regularly within top 10 safest country as well as one of the peaceful country in the world. The second is world-class education. Canadian education system is considered as one of the best in the world. There are many top universities in Canada. Also, there is a free education from kindergarten up to 12th standard. Similarly, Canada has the provision for universal health care for its permanent residents and Canadians. According to a report, Canada spends more than $6,000 on average per person in a year for health care. Next, it is the 10th largest economy in the world. So Canadian economy is stable and growing. There are a lot more to mention about Canada, but let's focus on nursing in Canada for now. There are different types of nurses in Canada. Registered practical nurse RPN, licensed practical nurse LPN. These are the similar word, but some province use RPN, some province use LPN. And registered nurse RN, nurse practitioner NPs. They do have different roles and responsibilities, different pay scales, and they do require different education level. For RPN or LPN, they require diploma certificate, which can be done in 16 months to 2 years. For RN or registered psychiatrist nurse, they need 4 years of bachelor's degree. For NP, they need a master's degree, which is a specialized course for nurses with minimum of 2 years of nursing experience as an RN. Now, let's begin with roles and responsibilities for RPN. These are just the general overview of roles and responsibilities for RPN. They are: provide patient-oriented and goal-directed nursing, communicate ideas and concerns, assess patients' health needs, initiate the electronic medical record patient vitals and prepare patient, maintain accurate, concise, and confidential EMR documentation, attend relevant conferences and workshops and in services. Point to be noted: roles and responsibilities varies depending on the organization they work, and generally RPNs are assigned to take care of stable and uncomplicated patients. Next, roles and responsibilities of an RN. These are just the overview of general roles and responsibilities. RNs are responsible to assess patients, to collaborate with other team members, administer medications and treatments, monitor, assess, document and report, supervise RPNs and other nursing staff, develop and implement discharge planning, teaching and counseling. Again, point to be noted, these are just the overview of roles and responsibilities. These may vary depending on the organization they work. Generally, RNs are responsible to take care of complicated and unstable patients. NPs, role and responsibilities. NPs are the advanced registered nurses with broad scope of practice. They can order and interpret screening and diagnostic tests. They can diagnose health and illness conditions, discuss healthcare options with patient and make decisions. They do have authority to prescribe medications. They can treat and manage acute and chronic illnesses. They can make referrals to specialists as needed. Now, regarding my experience, I would like to give a brief explanation of my background. I am an internationally educated nurse. I have an experience of working as both an RN and RPN, currently enrolled in nurse practitioner course. To be honest, it was a real challenge for me to work in Canadian nursing environment, as nursing in Canada is different from my previous country in some ways. I feel lack of guidance, information, and knowledge made the journey tough in the initial days. As a nurse, I believe it is important to have knowledge about Canadian work environment, culture, roles and responsibilities, scope of nursing practice, nursing rights, rules and regulations. From my experience, now I emphasize the use of critical judgment, time management, and prioritizing nursing care. Another important skill to learn is use of soft skill. It takes time to learn soft skills like way of communicating with people, but believe me, it will improve with time. Now, I feel nursing is a rewarding job with flexible schedule, health benefits, good pension plan for future, and lots of scope. The scope of nursing is very wide and has a huge demand in Canada. Qualified nurses are in high demand as I just mentioned. Canada need nurses countrywide at all level. Most of provinces are facing the shortage of qualified nurses. So just the statistics shows Canada will need over 60,000 nurses by 2022. In next 10 years, it will be almost 142,000. Among many regions, the reason behind the shortage is 1.4 million seniors in Canada in need of continuing support. Salary. I believe this is the most important and interesting part for you. Nurses in Canada do have attractive pay scales. Generally, RPN or LPN will earn $45,000 to $65,000 per year. As an RN, it's $70,000 to $90,000 per year. And as an NP, it's $90,000 to $120,000 per year. But point to be noted, the pay scale is different depending on the years of experience, types of organization you work, and the province where you work. If you are interested to migrate in Canada as a permanent resident, then the first thing is to upload your profile through Express Entry. Express Entry is a system where you start your online application for permanent residency as a skilled worker. I would explain in detail about its process in next video. Thank you so much for watching. Do not forget to subscribe and press the bell icon for notification. I'll meet you in next video. Take care.